and when the mosquito, uninfected mosquito bites again, the virus enters inside the mosquito system. Inside the mosquito, the virus again multiplies in the body of the mosquito, and it goes and lodges itself in the salivary gland, so that next time when this mosquito bites another person, the dengue virus is injected into the new host, and in this way the cycle keeps continuing. And therefore, in the life cycle, these two hosts, that is the mosquito and man, is of primary importance in its life cycle. So once the virus enters the body, what happens is there are clinical symptoms, or there are different forms of dengue. But interestingly, in dengue, what happens is that what we call as sequential infection. So suppose a person has been infected with a type 2 dengue virus some time ago, the person may or may not develop a mild fever or clinical illness. But suppose this person, after a week or 2 or 3 weeks, gets bitten by another mosquito, then another dengue virus enters the body, and the previous virus, the immune reaction is enhanced. Because of the previous virus, the immune reaction, instead of getting suppressed, is enhanced. So what happens in dengue fever is that there is what is called an immune enhancement, and that enhancement of immunity is what results in a very severe clinical features when the second virus enters the human body through the mosquito bite. And therefore, if there is different combination of viruses entering at different times, you get a clinical picture of dengue. And the spectrum of dengue is as such that one that can be a subclinical infection, that is the virus has entered the body but the person has no symptom at all, and later on when you do an antibody test, that is IgG antibody, it may just come positive, but the patient will tell us that he's never had fever at all. So that is the subclinical dengue. Then there is clinical dengue, where the person will develop fever, body aches, headaches, dehydration, maybe vomiting, weakness and backache. And the backache used to be a very typical feature, severe low backache, when the fever was present in African continent. Therefore, in Africa it is also called break bone fever, that is the bone pains and the backache used to be a very severe feature. However, in our clinical setting, although we do get backache, it may not be a very prominent feature of the infection.